Hello, this will be my demonstration of a pelvimetry exam. I've never done one. Um, I don't think that they are routinely used, in my preceptor's practice. I've actually never seen her do one either. Um, but here it goes. So ideally, you would explain the procedure to the client first, and have her consent to do it, and then you would wash your hands, which I'm not going to do for the video. And you would get a pack of sterile gloves and you would open it so that the glove is laying on the sterile packet. And then I would personally open your pack of lube, or if you have a bottle or whatever, and squirt it on the packet so that the lube remains sterile as well. And most sterile gloves come with the edges folded down, which I kind of did that. I don't know if you can see in the video, but that way you can grab the inside edges of the glove and put it on without touching the outside of the glove, and then you would pull it down. Then you would, scoop your lube up off the packet, lube your fingers, and then do just an overall visual assessment of the vulva and the other areas, so other surrounding areas. If everything appears normal, then you would advance 2 fingers into the vagina like so. I find this to be the most comfortable way to do it. If you advance horizontally, it can be more uncomfortable and a little harder, I think. And so I go vertically and into the vagina. And when you first begin your exam, you are going to be feeling for the sacral promontory. My pelvis is really little, so I can touch it. But I've measured my fingers, and I should not probably ever be able to touch a normal gynecoid pelvis, like a promontory. So if I could, it would be a cause for concern. So then I would move to the pelvic brim, and I would check to make sure that it is rounded. I would then move down to the sacrum. You want to see if it is rounded, if it seems flat, or you can, if you can't touch it, that's okay. You might not actually be able to feel every bone that you're looking for, but if you can feel it and it feels flat or not rounded, that would be a cause for concern. I would ideally, I think, like to check the coccyx for mobility. Obviously, I'm not doing this with 2 hands, but for the sake of the video, if you can see this part back here, it should move just a little. If it can't, if it feels very, very stiff, that would also be kind of a cause for concern. Then I would check the side walls of the vagina, or not the vagina, but the pelvis, to make sure that they were rounded. If they either caved in or bowed out, that would be a cause for concern. And like I stated, you might not actually feel every part of it, but if you do feel that it comes in a little more, or just is shaped differently than the average pelvis, I would just make a note of that. Then I would check the sacroiliac notch, and I think that a couple of the videos I watched actually measured their fingers and then measured this. So that might be worth doing. I didn't actually measure my fingers for this. I know one of them is 1 centimeter just because I've done a couple of cervical checks, but so they're like one of them is 1 centimeter, so I guess that works. So yeah, so then I would check that. Once you have checked your sacral iliac notch, I would then check your ischial spines. So when you are doing a cervical check, this can be very important when trying to determine how far the baby has descended down into the pelvis. This definitely helps, figuring out station. Then I like to, or I guess would like to, I keep saying like to, like I've done this before. I have on the pelvis several times, so I kind of was trying to figure out a way that it would just kind of flow the easiest for me with the way that I move my hands and stuff. And I've learned that I really have to watch this thumb because it seems to want to do whatever. I guess I don't really pay enough attention to it. Anyway, so after you've checked your ischial spines, then I would turn my hand over and feel the pubic symphysis and the pubic arch just to see if it's, kind of at a 90-degree angle. I think they said like 85 to 90 is normal. If it is, and then you would remove your fingers from the vagina and make a fist, and you would place your fist between the two bones, and if they touch, which on my pelvis, depending on where you put your hand, they do. So this on a normal pelvis would be a cause for concern because my hands are very, very little. If you can't touch it, or if I can't touch it, or have quite a gap on each side, then that would probably mean that the pelvis was normal in size, I think. So yeah, there's my pelvimetry example. I don't know if I will ever actually do this on someone, but it's definitely useful information. Thanks.